Bismillahirrahmanirrahim. Assalamu alaikum everyone. This is Hamza Hussain and welcome to Pakistan Cardiac Super League Season 2 presented to you by Pakistan Cardiac Society and powered by Wilson's Pharmaceuticals. Today we are live for the 11th match of Pakistan Cardiac Super League Season 2 which is between P.I.C HAWKS from Lahore and L.N.H Pelicans from Karachi. P.I.C HAWKS have already won their group match and they are leading this group with 2 points while L.N.H and HMC Stallions have drawn their first match and they both have 1 point each. So, by PAC Hawks can qualify for Super 6 by winning this match. And before diving into the excitement of this match, I will allow me to introduce the expert panels who are graced us with their presence today. We have with us Professor Mohammad Isaaq Saab. Professor Isaaq will be the match umpire of this match, and Professor Isaaq is serving as a distinguished cardiologist at Karachi Institute of Heart Disease. And we also have with us our General Secretary of Pakistan Cardiac Society, Professor Fawad Farooq Saab. Professor Fawad Farooq Saab is serving as a professor of cardiology at National Institute of Cardiovascular Disease, Karachi. And we will also be joined by the chairman of Pakistan Cardiac Super League, Professor Feroz Mehman Saab. Professor Feroz Mehman Saab is Professor of Cardiology and Vice Chancellor at National University of Modern University of Tanda Muhammad Khan. And last but not the least, I will introduce the moderator of this program, Dr. Hamza Gauri Saab. Dr. Hamza Gauri is working as Assistant Professor of Cardiology at Albany Institute of Cardiology. And I will now hand over the mic toward Dr. Hamza Gauri Saab to please start the formal proceeding of this match.
Thank you very much, Hamza. So we are back again to the second season of Pakistan Cardiac Super League, which is brought to you by Wilson's Pharmaceuticals in collaboration with Pakistan Cardiac Society. So today we are again here to witness another match, another league game, and this time it's going to be L.N.H, Liaquat National Hospital Pelicans versus Punjab Institute of Cardiology, HAWKS. So it's getting more and more interesting as we are moving ahead with the league games. So with this, I would now like to welcome our panel of experts, our council members for the day, and it's going to be Professor Fawad Farooq Saab. Welcome, sir. We have Professor Feroz Mehman with us, and the umpire for today's game, and he's always there officiating the matches. It is Professor Isaaq Saab. Sir, it's great to have you all here for the game today, and it's a bright sunny day as usual, so I'm expecting a high scoring game as we are all hoping. So with this, I move to the two teams and the captains of the teams to please give the introductions of their respective teams. So I move to L.N.H Pelicans to start with the introductions, please. Can we have them on the screen?
Assalamu alaikum.
Okay, we have them on the screen now.
Yes, sir.
Wa alaikum assalam.
I am Dr. Tuba Osama, representing as team captain of L.N.H Pelicans. On my extreme right, we have Dr. Sadia. On my right, then we have Dr. Shafaq. And on my left, we have Dr. Faryal.
So we welcome you to the game and best of luck. So moving to P.I.C HAWKS. Can we have the introductions, please?
I'm Dr. Abdul Rahman. On my left is Dr. Alayar. On my right, Dr. Shaheed and Dr. Zarguna.
All right. So, welcome to the game, and I hope it's going to be a good one today. Best of luck to both the teams. And with this, we are now going to move to the next stage, which is going to be the electronic coin toss. So, can we have the coin on the screen? All right. So, I'm just going to randomly ask one of the teams, P.I.C. Hawks, to call either heads or tails.
Heads.
Yeah.
Heads it is. Please roll the coin.
Sir, yes, sir. Sorry.
So it's heads.
Heads.
And I think, as we can see, maybe some of you are unable to see it. So it's heads, I believe. PIC has won the toss.
Yes, yes.
Good. PIC, as you won the toss,
We-
I'm going to pose you with two questions. You want to throw or take the questions?
We will take the questions first.
So they want to take the questions. And the second question now from my side is whether you want option A or
Case A.
A, and they are going to take the questions. All right. So can we have the case on the screen now?
आवाज थोड़ी ऊंची कर दूं।
A 35-year-old lady with no previous comorbids present with complaint of dyspnea, NYHA class 3 and retroesternal chest discomfort for the last 2 months. She also complains of low-grade fever on and off and sweating at night. Her physical examination is significant for raised JVP and a pericardial rub. She was vitally stable at presentation. She noticed that she has lost some weight unintentionally and generally feels weak.
Hamza, are you there?
Yes, sir.
I'm there, sir. Dr. Fawad.
Okay.
Very much. Can you
Okay.
hear me?
Yes, yes.
Okay, so please, can we have the first question? Right. Read the question, please. Pelican.
Which of the following is the next most appropriate investigation? A is ECG, B drop-eye, C CKMB, D is chest X-ray, and E is 2D echo.
And you have 60 seconds to answer the question. Time starts now.
We will go with E2D echo.
Okay, so are you sure you want us to lock 2D echo, which is option E?
Yes, sir.
All right, so they have come down the wicket. They want to play a quick fire innings, I believe. All right, if that's what you want, we'll lock it. Lock option E. Oh, wrong answer. So the first one dodged you.
Yes, agree, Hamza. They're going too fast.
I'm sure Ishaq Saab must be feeling the same thing, and so is Dr.
Because-
Firoz. So I think you watch the next one carefully. Can we have question number 2? Read the question.
Which of the following options best describes the components of a typical pericardial rub? A is atrial systole or atrial diastole. B is atrial systole, atrial diastole, or early ventricular systole. C is atrial systole, atrial diastole, and late ventricular systole. And D is atrial systole, atrial diastole, and early ventricular diastole. Is atrial systole, atrial diastole, late ventricular diastole.
And the timer starts now. So the answering team, which is PIC Hawks at the moment, can keep their mic unmuted so that we can hear the discussion. The rest I would request to keep the mic on mute. So we can't hear PIC discussing anything.
मेरे ख्याल में उनकी जो इंटरनल डिस्कशन है उसको हमारा एक्सेस होना जरूरी नहीं है
20 seconds and we can't even see them. 17 seconds. Can we have them on the screen? Approaching 10 seconds. Are they there? Do we have PIC? 7,
B.
6,
We
answer.
can
sir.
see them.
We will go with the option B.
Option B. B for beta.
Yes, sir.
Okay, they want us to lock option B. Lock it. Oh, that's another miss. Well, two
Early
difficult ones, I would say, or they were casually dealing with it. But this one, I think they tried to utilize the maximum time that they could. Anyhow, better luck on the next one. Question number 3 on your screen. Please read the question.
I can't see the question.
Okay, can you see the
Considering the local demographics, which of the following is the most likely cause? A. Tuberculosis. B. Coxsackie A. C. Streptococcus aureus. D. Fungi. E. Idiopathic.
Your 60 seconds are on your screen.
We will go with the option A, tuberculosis.
Okay, are you sure? You want to go with option
Okay,
A?
sir.
You still have time.
Yes, sir.
Are you dead sure? Okay. So, they've come down the wicket. Let's see if this one goes for a 6 or not. Option A, tuberculosis. Lock it, please. Oh, yes. As sure as they were. Well played, well done. So, they're on the board now. Well played. Can we have question number 4? Read, please.
Which of the following drug is known to cause drug-induced pericarditis? A. Aspirin. B. Phenytoin. C. is omeprazole. D. Steroids. And E. azithromycin.
Sixty seconds to answer.
We will go with the option B, phenytoin.
Okay, so they want us to lock option B, phenytoin.
Yes, sir.
All right,
Yes, sir.
lock option B then. And that's one over the covers. That one is definitely over the covers for a 6. Well played, well played. So slowly and gradually, I think they are coming into form. That's good to see. Well done.
Gaining momentum.
Surely they are. And we are expecting to have a good total this time. We've had a couple of low scoring matches, so we are hoping for the best. Moving on to question number 5. Read it.
Which of the following is known to be a poor prognostic marker in pericarditis? A is acute presentation. B subacute presentation. C tuberculous pericarditis. D old age. E young age.
And the timer starts now.
Sir, we will go with the option B, subacute presentation.
So you want to go with option B, beta, subacute presentation.
Yes, sir.
All right. So has it been flicked for a 6? Let's find out. Option B, lock it. Yes, It has been. Well done. So that is 3 in a row now. Well, keep it going. Good job. Question number 6 is now on your screen.
The patient undergoes an ECG that shows generalized T wave inversions. Which electrocardiographic stage of pericarditis do these changes significantly? A is stage 1, B is stage 2, C is stage 3, D is stage 4, E is stage 5.
Timer starts now.
सही है, एग्री हो मेरे साथ सारे? नहीं, वो 1 में होती है। तो 1 में PR जो होता है ना, 1 में अपराइट होती है, 2 में इन्वर्ट होती है, 3 में फ्लैट और 4 में अपराइट होती है।
बोल दे।
1 में ST एलिवेशन होती है और PR डिप्रेशन
20
होता है।
seconds.
मेरा B है, स्टेज 2 ही है। स्टेज 2? We will go with the option B, stage 2.
Okay, so they want to go with option B, beta, stage 2. All right, let's see where the ball is turning. Option B, lock it. Oh, so turns out it turned the other way. Okay, missed. Well, interesting one.
This was a bit tricky question anyway.
Yes, I totally agree with you, sir. Well, never mind, you still have a few more questions. Right.
Googly.
Moving on to question number 7. Fawad Saab, I believe, wanted to say something. Sir, we'll catch up with you after this. Question 7. Go ahead, please.
The patient undergoes echocardiogram which shows biatrial enlargement, shiny filling pattern and septal bounce. There is a minimal pericardial effusion with no tamponade effect. How will you classify this pericardial constriction? Clear नहीं है.
Option A is transient constrictive pericarditis. Option B is effusive constrictive pericarditis. Option C is chronic constrictive pericarditis. Option D is permanent constrictive pericarditis. And option E is none of the above. And your timer starts now.
We will go with the option C, chronic constrictive pericarditis.
कर दें.
Hello?
Okay.
Hello?
Okay, so I think now you have me back. There was a technical issue. So 10 seconds to go. And which option have you picked?
C, chronic constrictive pericarditis.
Chronic constrictive pericarditis. So we are going to lock option C. Oh, another one missed. All right. I think you really need to focus on the last few questions that you have in order to get a reasonable total. So I'm sure Dr. Fawad will have something to say here, as he was.
So I think continue with it. Their face continues to Googles.
Right, sir. So, moving on
Sir.
to question number 8.
Yes.
Come on,
Transient-
Hawks. Read the question, please.
The JVP of the patient is traced as mentioned in the history. Which of the following will represent the characteristic rapid ventricular filling in early diastole? A is prominent X descent, prominent B is prominent Y descent, C is prominent A wave, D is prominent V wave, and E is none of above.
And 60 seconds start now. 20 seconds.
Sir, we will go with the option B, prominent Y descent.
All right, so you want to go with option B again, which is prominent Y descent. You really like option B. So I'm going to lock option B. Yes, but this time you liked it right. Well done. Another 6. Very well played, this one. And you still have 2 more questions to go. Best of luck for that. Question number 9 is on your screen now.
Which of the following Doppler parameters are expected to be present in patient's echo? Options are not clear.
Okay, so
Inspiratory, hepatic,
okay. Yes.
diastolic flow reversal, inspiratory, hepatic, systolic flow reversal. C is
Hepatic
if you have
diastolic
not clear.
reversal.
Huh.
Okay, I'm going to read it. Hepatic diastolic reversal to forward velocity ratio in inspiration of more than 0.79. Option D is hepatic diastolic reversal to forward velocity ratio in inspiration of less than 0.79. And E is E to A ratio less than 1. And 60 seconds are on your screen. I think Pelicans are actually having a technical issue in terms of visibility of the options. Less than 20 seconds. Ten seconds. Come on, Hawks.
We will go with the option C, hepatic diastolic reversal to forward velocity ratio
Okay.
in inspiration mode
Right. So they want
more than
us
0.7.
lock option C. Lock option
Yes,
C,
sir.
please. Oh, yes. That's well done. Well played. Very well played indeed. So I think we are going towards a reasonable total. And with this, we have the last question of this innings, question number 10 on your screen.
What findings are expected to be seen on strain imaging? A is reduced global longitudinal strain. B is preserved global longitudinal strain preserved circumferential deformation. C is reduced global longitudinal strain and reduced circumferential deformation. D is preserved global longitudinal strain and reduced circumferential deformation. And E is none of the above.
And the timer starts now.
We will go with the option D, preserved global longitudinal strain and reduced circumferential deformation.
D delta. So you want me
Yes, sir.
to lock option D, right?
Yes, sir. Yes, sir.
Okay. As they say, lock option D and let's see. Is it going for a 6 or not? It is. Very well played. And this one definitely takes us to a competitive total of 36. And we come to the end of this first innings. Very well done. I think the score to beat is 36. And the Pelicans will have to get 7 answers right in order to beat this and 6 answers to level it. And with this, I ask the panel of experts, before I move to that, our umpire for the game, as always, Professor Dr. Ishaq Saab, sir, your thoughts on the game?
Thank you very much. I think they played very well. And the question was reviewed by me, and one or two answers were a bit tricky, but then there was support from the literature, and the correct answers were picked up, you see. So I think they played very well. It's a reasonable score, and the scenario was a very common scenario that we come across in our population, especially coming from the rural areas. Tuberculous pericarditis is quite a common condition, and I'm glad that they answered some of the tricky questions as well correctly. So very well done, and let's see what the other team does.
Thank you very much, sir, for your input. I think very rightly said and pointed out. This is something which is extremely important in our setting, and this is the real clinical cardiology. And with this, I now request Professor Feroz Memon Saab to give his views on the game so far.
Thank you very much, sir. I'm really grateful. The way you are conducting and moderating, it's excellent, very pleasant and very nice. It's great. Hawks played very well. I'm happy, and I'm more happy that we are having more questions from our basic practice, from clinical practice. We are out from the difficult task, because these are the patients who come and see us. This was an ER, but normally these patients come to us in OPDs and clinics as well, after being halfway treated by some consultant. The patients are not happy, they come to you, and then what you need to see is the clinical aspects of these patients, and that is what Hawks should realize, that they should have done replied ECG in the first instance, because without that, going to echo, Doppler, MRI, CT would be of no use. It's a wonderful game. I really enjoyed. Congratulations, Hawks, and I'm sure L.N.H is going to play fairly well as well. Thank you very much.
Thank you very much, sir, for your extremely valuable comments. It's always great to have you, and in fact, the whole esteemed panel with us. Such a wonderful show, I think, and we are all excited to have this going on. I think it's going to be a good game today, and we have Professor Fawad Farooq. Sir, what do you think? What's going to happen?
I think we are expecting a very close match.
Yes, keeping the fingers crossed.
Firstly, I'm really thankful to Professor Ishaq, because his presence in every match is really putting that weight to this whole competition, that we are all encouraged to attend this, and it's really making a lot of difference. It's a source of encouragement for the organizers as well, that a personality of his stature is always there in every match, and for participants as well. So firstly, I'm really thankful to Professor Ishaq, making this whole competition a very, you can say, now it's really is accepted in a way that it's really giving a lot of knowledge to us as well. Those topics which are not frequently go through us, and we are seeing a lot of new things in it, and then further validated through literature. So it's enhancing our knowledge apart from that ischemia and intervention. So overall, a very nice thing going on, thanks to Professor Feroz Memon, as well, as he initiated this whole thing, and this is the second season going on. And lastly, Wilson and Hamza as well. Both Hamzas.
Very right, sir.
Adding
Thank you.
color to it. But one thing I would say, the answering team, to keep your mic open while you're discussing in between, because that 60-second pause create a bit of you can say dullness to the program. Your discussion apparent to us, that again creates a lot of, you can say, add color to the competition. So I would suggest all answering team to open their mic when they are discussing. Over to Hamza.
Thank you, sir. I think nicely highlighted 2 points. I would say, yes, the impetus has been provided by Professor Ishaq Saab. I think his presence has made all the difference, and everybody is now there as an obligation, and it has become a force. And I think the credit goes to the whole team, the panel of experts, our council members, and Wilson's Pharmaceutical. And yes, I totally agree with you. I think once they are there, the conversations that we have on that side amongst the team members, the camaraderie that you get to see, so that tells us a lot about them, and this definitely adds a lot of color. Right now, it's the Pelicans, L.N.H. Pelicans, who have a job in their hands, and that is to beat the score of 36. And let's see, as we are going to commence the second innings. So can we have the second scenario, case scenario B, on the screen, please? And I would request P.I.C. Hawk to read
A
the scenario.
45-year-old lady known case of a 45-year-old lady known case of CKD5 dialysis dependent presented with complaints of dyspnea and NYHA class 3 for the last 2 weeks. On examination, she has a blood pressure of 100 by 70 millimeter of mercury, heart rate 100 per minute, saturation of 94% at room air. Her cardiac auscultation reveals muffled heart sounds, while chest auscultation reveals bilateral decreased air entry on auscultation with decreased tactile parameters. And ECG, chest X-ray and bedside echo are planned.
All right, so you have a couple of seconds to gather yourself, L.N.H. Pelicans, and then we'll start. Okay, so can we have question number 1 on the screen? Please read the question.
What are the clinical findings suggestive of? Option A, pleural effusion. Option B, pleural effusion and pericardial effusion. Option C, lung collapse and pericardial effusion. Option D, parapneumonic effusion and pericardial effusion. And option E, none of the above.
Okay, hold on. Yes.
Actually, screen is too short.
Okay,
we
so
can't actually see the
technical
question.
team, please look into it. You can't see the options? You can't see all the options?
Screen is too small, so we can't clearly
Can
see
the
the
technical
question.
team over there help us?
And have you been able to read question? The
No,
question?
sir.
No. I think, Hamza, we have to give them first a chance to read that question scenario again.
Yes. I think they have some
1 or 2
technical
minutes
issue
and
in
then
terms of the
start
internet. So you want to take a look at the scenario? Could you read the scenario, Pelicans? I'll request
Is
the
it
technical
okay,
team over
L.N.H?
there.
Is it okay for you now?
No, it's a small.
Small. Please, technical team.
Yeah,
please.
it's fine.
Okay,
It's
you
fine.
can.
Okay. Just you have like 1 minute. You can go through this scenario yourself, and we'll start question afterward.
Yes, and you can let us know.
Can you keep your laptop near you?
Okay, so Pelicans, you're able to read the scenario, right?
Yes, we have read the scenario.
Okay, Hamza.
So they have read the scenario and they can bring the laptop closer to themselves if that's a possibility. Okay, and I'm hearing a lot of crosstalk from different members, so I would request everyone to please keep their mics muted. And I will request, yes, please, yeah. Okay, so can we move to question number 1 now, Pelicans? Can you see it now?
Yes.
Okay, so read the question, please.
What are the clinical findings suggestive? What are the clinical findings suggestive of? Pleural, option A, pleural effusion. Option B, pleural effusion and pericardial effusion. Option C, lung collapse and pericardial effusion. Option D, parapneumonic effusion and pericardial effusion. Option E, none of the above.
And your timer starts now. 60 seconds to answer.
It's B.
Okay, so which option? Option?
B. We will
Option-
go for B.
Option
B.
D,
B.
Delta.
Book. B. No. B. Go.
Option B, pleural effusion and
Pleural
pericardial.
effusion. D. Pleural
Oh.
effusion and pericardial effusion.
Okay, now we can hear you. Option B. So lock option B, beta. Well done. That's a good start. Very well done. And I think we
Good
have a game
start,
on
good
our hands.
start. Yeah, good
Ishaq
start.
Saab is excited, and so are we. Good. So, moving on to question number 2 now. Read the question, please.
The screen is small again.
Okay, so okay, I will ask the technical team to fix the issue again, and in the meantime, can we have a solution to that?
We
Can you
can't
bring
read
it
the
closer to
question.
them?
हमारा भी नहीं नजर आ रहा
With
Okay,
the
so we,
permission of my colleagues, can I make a suggestion that
sure.
we should have printout of these questions and we should give them printout as well. That makes it very easy to
I think so. That's a good
facilitate.
suggestion. Yes, I think that's a good suggestion.
We should keep a printout and give the printout to them. While we read, they should have the printout as well.
Very right, sir. I think the technical team is listening. In cases where we have some technical issue and internet issues like this. So, can the technical team guide us on this? Can we bring the screen or the laptop closer to them? Pelican, is it clearer now?
A more detailed examination shows dullness on percussion, agophony, and bronchial breathing beneath the left scapula.
Okay, please carry on. Yes, yes.
A more detailed examination shows dullness on percussion, agophony, and bronchial breathing beneath the left scapula. What is this clinical sign called? Ewart sign?
Excuse me.
Yes,
We
L.N.H.
can't see the question.
You still can't see the
Screen is
Okay, hold on. So we'll stop here. I'll request P.I.C. HAWKS to hold on as well because I think they seem to be having a technical issue there.
Wilson, do you have any representative at L.N.H?
Yes, sir, we do have.
So you can give link of the expert links to one of your representative. They can show them the question on their mobile phone as well. So
Sure, sir.
that mobile phone can be given to the team with connected link. So if it's not apparent on their main screen, they can see it on their mobile phone.
I think that's a good suggestion. So they are working on it, but we need to have some kind of
But I think in future we should have printout as well.
Very right,
we should
sir.
keep the printouts.
Yes.
And we should hand over the printouts to the team.
So issue with printout is if you give 10 questions altogether to them, then
no, one by one.
Yeah,
one by one.
Then you have to have a member there who is going one by one question as it displayed on. You can give the next question as a team.
Yes.
If one connection of the main is on phone to the captain can be given. That's not a big issue. And that should be without like video. Their own video is not displayed on it. And this captain can have his connection with his mobile phone so that if it's not apparent on main screen, he can see it from his own mobile phone.
But Fawad, printout is like a backup.
Yeah, this should also be there. But even
I think, sir, these are two important suggestions. You both have extremely valid points. We can have a backup and then a backup to a backup. Why not?
Yeah. Agree.
So, do we have the screen? Okay, can you read it?
Yeah.
And can you see
Yes,
it,
sir.
Pelicans? All good?
Yes.
Okay.
Yes.
So, well, we are back, and I am just going to quickly read it myself, which is question number 2. A more detailed examination shows dullness on percussion, agophony, and bronchial breathing beneath the left scapula. What is the clinical sign called? A. Ewart sign. B. Beck sign. C. Tallis sign. D. McLeod sign. E. Peters sign. And 60 seconds start now. सोच रहे हैं. 20 seconds. I think they're going to take a big swing at this one.
It's A.
Are you sure it's option A?
G.
Okay, you want me to lock option A. Lock it then. Oh, yes, you got it right. Well, well, well. You definitely did.
It's a familiar sign. It's a familiar name, you see.
Yes, yes.
Even we
I don't.
remember as well.
Very right, sir. I think this was on exclusion. I think this was making sense. So, very well done. And we have a good start by Pelicans, although we did have a few technical hiccups. Hopefully, the sailing is going to get smoother from here on. Question number 3 on your screen now.
A chest X-ray is performed, which shows globular heart on AP view and a vertical opaque line separating a vertical lucent line directly behind the sternum on lateral view. What is the name of this sign seen on lateral view? Option A, vegetable sandwich sign. Option B, Oreo cookie sign. Option C, beef burger sign. Option D, pepperoni pizza sign. And option E, Syrian shawarma sign.
Okay, so your timer starts now, but I think it seems as if we've gone to a restaurant.
Yeah.
It's a fast food era.
And we are all waiting for like lunch with these names.
Making it more tempting.
Yeah.
Approaching 20 seconds.
Hmm?
10 seconds. Come on. 6, 5. Come on.
It's E. E. E.
E. Epsilon.
Syrian shawarma sign.
Syrian shawarma sign.
Yes.
Okay. Well, lock option E. Syrian shawarma sign. My goodness, what made you choose this one? So we've definitely missed this one. And if there was one thing I was going to say not to pick was this one. So
This is the Syrian shawarma. Yeah, agree.
so well done, very well done. I think interesting one, but you've missed this one. I thought you were gonna pull out another 6 to make it 3 6s in a row. Never mind. We have question number 4 on the screen. Read the question, please.
An ECG is performed that shows low QRS voltage. How would you define low voltage QRS
Screen is
complexes?
small again.
Oh man.
Okay. So can you see the screen now? Pelicans.
Yes. Yes, we can see.
Okay, please go ahead and read the question.
An ECG is performed that shows low QRS voltage. How would you define low voltage QRS complexes? Option A, QRS voltage less than 5 mm in precordial leads. Option B, QRS voltage less than 10 mm in limb leads. Option C, QRS voltage less than 5 mm in limb leads. And option D, QRS voltage less than 3 mm in limb leads. Option E, QRS voltage less than 12 mm in precordial leads.
And the timer starts now. So I'm going to request the technical team, if there is an issue with the screen, they can't see it, they should hand over the mobile, and that will make it easy for them to read and will cause less disruption. We are approaching 20 seconds now. 15 seconds. 10 seconds.
It's C. C.
Okay,
C for
C.
cat.
Option C, less than 5 mm in limb leads, right? Okay, so lock option C. Oh yes, very well done, and this one is hooked for a 6. Good one, very well played. I think it's getting to the wire. So far so good by Pelicans. It's a wonderful innings that they are playing at the moment. And with this, I think I would also like to bring this thing to our notice that there is a technical issue going on with the firewall all across the country, and I've just been told that we have internet issues everywhere at the moment. So I think we'll have to bear with each other and support this show at the moment and make the best of what we have in hand. And with this, we move to question number 5.
All of the following are causes of low voltage QRS complexes except option A pericardial effusion, option B obesity, option C emphysema, option D dilated cardiomyopathy, and option E hypertrophic cardiomyopathy.
60 seconds on your screen.
Hmm. Hmm. इसमें तो होती है, इसमें भी होती है। हाँ, कर दो ना बस। It's E. Hypertrophic cardiomyopathy.
Hamza, they are themselves looking sure that this is the right answer.
Sir, very much. So I think option E, hypertrophic cardiomyopathy. So I think we are going to lock it, but you've already reached half the score, 18. Let's see what happens. Option E to be locked. Yes, yes, very well done, well played. Now the score is 24. You just need a couple of more answers, 3 more answers, and you would have crossed the line. Let's see what happens. Question number 6. On your screen, please.
A bedside two-dimensional echocardiogram is performed that shows a circumferential echo-free space of 1.2 centimeter with no evidence of tamponade effect. How would you classify this VN in terms of size? Option A, trivial. Option B, mild. Option C, moderate. Option D, large. Option E, very large.
And timer starts now.
Moderate. हाँ, exactly. उसमें तो It's C. Moderate.
All right, you are sure about it? Option C?
Yes.
Should I lock it? Okay, as confident as they seem, they want us to lock option C, moderate. Lock it, please. Oh, yes. Very well done. Very well done. So I think the girls are really giving it a tough fight, and they've only dropped 1 question so far. Very well done. And it's a score of 30. And they still have 4 more questions to go. Well done. And I would ask P.I.C. HAWKS to give it a good fight. There is still a lot to fight for. Question number 7. On your screen, please.
At this stage, what is the next most appropriate step in management? Option A, pericardiocentesis. Option B, hemodialysis. Option C, hemodialysis with ultrafiltrate. Option D, IV diuretics. And option E, observe.
And 60 seconds are on your screen. Are they going to level the score on this one? Let's see.
हाँ, डायलिसिस ESRT थे तो Dialysis with ultrafiltration. A or B का तो सब फायदा है.
PIC Hawk might be praying for complete internet breakdown.
Yeah. Hmm. It's C. Hemodialysis with ultrafiltrate.
Okay. You want me to lock option C, hemodialysis with ultrafiltrate, right? Should I lock option C? Option C?
Yes.
Okay. Lock option C. Oh, yes. That is very well done. And with this, you have leveled the score. It's 36 apiece, and you still have 3 more questions to go. Well, I think if you continue like this, we may have a new record. Well. So, well done. And let's see whether you get the next 3 right. With this, we move to question number 8. On your screen now.
The patient undergoes hemodialysis and becomes symptom-free. However, a week later, the patient presents again with complaint of chest pain and dyspnea NYHA class 4. A repeat echo is done that shows 0.5 centimeter echo-free space in pericardial space. Which of the following findings are expected to be seen that might suggest tamponade physiology? Option A, early RA diastolic collapse. Option B, late RA diastolic collapse. Option C, early RV diastolic collapse and early RA diastolic collapse. Option D, late RV diastolic collapse and late RA diastolic collapse. And option E, late RA diastolic collapse and early RV diastolic collapse.
The timer is on your screen. 60 seconds.
अरे हाँ क्योंकि देखो ये माइग्रेन में आ गया करेगा देखो 0.5 की माइग्रेन में अभी 1.2 तक
Approaching 20 seconds.
और NH short of that
15. 10. Come on.
C करना C. It's C. Early RV diastolic collapse and early RA diastolic collapse.
So they are all pretty much united on this front. C karna hai. So it's option C, right? I'm going to lock option C. Lock it, please. Oh, we have missed this one. So that's the second question that they've dropped so far. And never mind, you were doing great, and I think you can still do pretty good. Moving on to the next question, which is question number 9 on your screen.
A decision is made to proceed with pericardiocentesis via subcostal approach. Which of the following is true about the said approach? Option A, potential risk of injuring right coronary artery. Option B, potential risk of injury to the internal thoracic artery. Option C, higher risk of pneumothorax as compared to parasternal approach. And option D, most inappropriate for emergent situations. And option E, least risk of liver injury.
And the timer starts now.
True बताना है ना.
So HAWKS are pretty much eager to see what happens, because you see, not only are they going to lose, they were also at a stake of losing the highest total which was scored by them. That was 48. Now they can still equal it if they get these 2 questions right. Let's see.
इन्होंने हमें अप्रोच नहीं बताई ना. अच्छा नहीं सब क्वेश्चन है. सही है.
Pelicans have all to play for. 20 seconds left. 15. 10 seconds. Come on, Pelicans. 7, 6.
B.
Answer.
B.
D for
Potential risk
Delta.
of injury to the internal thorax. B. Ball.
D, most inappropriate for emergent situations.
No, potential risks of injury to the
Okay,
internal
option B,
thoracic artery.
beta. All right. So they want us to lock option B, potential risk of injury to the internal thoracic artery. Lock option B, please. Oh my goodness.
Last ball.
Last ball, it has gone to the wire again, and I'm sure Dr. Fawad really wanted this. That's what he was hoping for, going to the last ball. Well, this is what it is. So now moving to the last question of the day, which is going to be the decider. As exciting as it can get. Can we have question number 10 on the screen? Read, please.
Pericardial fluid is aspirated, which comes out to be blood tinged. That spreads out on gauze and forms a pinkish halo without clot formation.
We
What should
can't
be
see the
done?
question.
Yes,
Oh,
any
okay.
issue, L.N.H?
Yes, it's visible.
Okay.
Pericardial
Okay,
fluid.
so please.
Pericardial fluid is aspirated, which comes out to be blood tinged. That spreads out on gauze and forms a pinkish halo without clot formation. What should be done? Option A, no need of intervention or investigation, as it is most probably blood tinged pericardial effusion. Option B, emergent
Screen,
cardiac surgery.
screen is not clear. Question is not clear. It's
Okay,
blood.
so they seem to be having a technical issue again. I think it's a crucial point in this match.
Oh,
Can you
it's
pass
fine.
them over any screen or mobile technical team?
Yeah, we can see that.
I think it's fine. Just continue from where you have left.
Okay, so please continue reading the question.
Option A, no need of intervention or investigation, as it is most probably blood tinged pericardial effusion. Option B, emergent cardiac surgery intervention, as it is likely to be chamber perforation. Option C, send pericardial fluid sample for hematocrit. Option D, send complete blood picture. Option E, both C and D.
And the timer starts now, 60 seconds.
I think this whole scenario has brought a lot of excitement and PIC Hawk camp. Previously, I was seeing a lot of depressive gestures like this and there, and now they are a bit excited. Let's see what happens. I think with draw, PIC Hawk will go to the next round.
बाकी तो सब.
Okay, so 15 seconds.
It's A.
Are you sure it's A? This is the decider. You want me
Not
to
for
lock
the
option A?
For group winner.
Yes.
And
Okay, so they are saying lock option A. Oh goodness, that was a googly. My goodness.
हमारे साहब को पहले से पता था बैच फिक्स्ड है.
Oh wow. So as convinced as they were, I think what a match. And with this, I think we have come to a draw, 36 apiece to both the teams. But on virtue of the previous performances and the scores, I think PIC Hawk is going to proceed to the next stage. So congratulations to PIC Hawks, Lahore. Well done. But I would also like to mention here L.N.H Pelicans. What a match, what a fight. And we thought you would get that record of highest score at one point when you were left with the last three.
हमजा इनको नजर लग गई क्योंकि they were doing so good.
Oh my God, sir, all that blame then goes to me. So, and I was really hoping. Bilkul. Sir, your thoughts, Sir Ishaq, how do you see the game?
यार बहुत interesting game था आज तो, and both the teams were well prepared. One or two questions were a bit tricky, but they were balanced to see on both sides.
Yeah.
So I think the weightage was equal. The challenges were equal. The cases were straightforward, our routine clinical cases. And as Feroz has pointed out earlier, I think clinical cardiology is something that is given not much attention these days against the interventions and invasive things, whereas clinical cardiology is the basis of cardiology, and we should not forget this. And one of the beauty of this tournament has been, and one of the reasons that I've been attending is, I've been learning a lot, and it's a sort of revival of clinical cardiology through these questions that we are seeing. So very interesting match. They both played very well. The girls were doing very well, but I think they just became too confident, overconfident, and they thought they're going to smash everything, but it didn't happen. But anyhow, I think both the teams were very good, and their mentors need to be complimented. I think this is just a fight. One has to lose, one has to win, and I think the spirit should be to continue efforts, keep on learning, adding to your knowledge, and never get discouraged or depressed. Thank you very much.
Thank you very much, sir. Yes, for sure. I think it's the process of learning which never ends. And no doubt, clinical cardiology forms the foundation of everything that we do as interventionists, or even as imaging cardiologists, or as clinicians. I think that forms the foundation, and we always have to give importance to that. And we do have Professor Feroz Memon Saab. Sir, your thoughts on this very interesting game that we've just had?
I think he's.
I think Dr. Fawad is there, so he's currently not there, I believe.
मुझे तो बस वो शेर याद आ रहा है, शिकस्त तो फतह तो मियाँ इत्तफाक है, लेकिन मुकाबला तो दिले नातवा ने खूब किया. So, but at the end of the day, congratulations to P.I.C. Hawk for their next round, and it's never a loss in a way for L.N.H. They have learned a lot from this whole competition, and there are seasons to come, and we are arranging few more competitions similar to this as well. So you have opportunities to really participate in these all activities later on. Just keep on enriching your knowledge. That's it.
Right, sir. Thank you very much. I think very valid points. This is going to keep their spirits high. It's never the loss, it's the whole process, and you always learn a lot from that. And I think even mere participation in this tournament, it's not a learning experience for them. I think it's a learning experience for all of us, even the council members, and they've said it time and again. And it takes a lot of effort by the council members and all those who are affiliated to finalize the questions and to finalize the keys and come up with all this. And the best part is, these are all new concepts, new questions, and indigenous to this whole process, which is Pakistan Cardiac Super League. So credit goes to the whole team along with Wilson's Pharmaceutical. And with this, do we have Dr. Feroz there with us? Sir, are you there? Because we have got a technical issue going on, I guess, and it's the internet all across Pakistan. So
I think he has left.
He has left, I think. Right, sir. So anything else, sir, you would like to add?
I think just go to conclusion.
बस मेरा ख्याल है कि it remains for me to thank Messrs. Wilson Pharmaceuticals and indeed yourself for conducting it in a very nice and palatable way and making it so pleasant. अगर moderator अच्छा ना हो तो आदमी को मजा नहीं आता बैठने का.
बिल्कुल.
So you are moderating very well, and then icing on the cake is Fawad Farooq's presence, of course. So I think it's a very pleasant sort of event on each Saturday that we have. And in addition to learning, we see our colleagues also on the screen, meet you, hear your beautiful voice, and the command that you have on moderation, excellent. So I think all of you need to be complimented, and thank you very much for having me again and again. Thank you. I'm really enjoying it.
Thank you very much, sir. Extremely humbled by your comments. I think you put a lot of the confidence that you've shown, and you instill a lot of spirit in us, all of us. I think it's that spirit which keeps us going. It's not only the best part of the day for me, in fact, it's the best part of the week for all of us. And we look forward to it. And with this, I would like to thank our worthy council members for the game today. And what a wonderful game we've had today. Outstanding game, I would say. And with this, we do know that there is one winner. I would say there are two winners today, and one just happens to move to the next stage, which is P.I.C. Hawks. But a big round of applause for our L.N.H Pelicans for the way they played today. So coming to the end, I think this is the best that we can have, and we are only going to improve from here. And I thank you all for your time and presence, and inshallah we'll see you in the next game, hoping to have similar kind of fights and good results. So I sign out from here. Inshallah, see you soon. Allah Hafiz.